Richika Shukla, and I am a founder and chairperson of India IVF Clinic. Fertility preservation. This is a very less talked about topic, and fertility preservation is basically preferred by patients who are either going some cancer treatment or they want to postpone their fertility due to some career issues, and because these days the age of marriage has increased a lot, so patients want to go for their egg preservation or sperm preservation. We do fertility preservation in patients of cancer also who are going to undergo chemotherapy, because when they undergo chemotherapy, then after that the egg reserve or the sperm reserve gets decreased, and so later on the patient is unable to conceive, or if they do conceive, if we plan a conception, then it is done by donor eggs or donor sperms, which obviously the patient doesn't like, because a person who is going for IVF treatment wants to retain his own genes and go ahead with it. Sperm preservation. In sperm preservation, we usually preserve the semen of the patient by ejaculation, and if the patient is not able to ejaculate, we can also take out the sperm from the testis and preserve it. And this is preferably done before the chemotherapy, so it's very essential for the patients to report to us before chemotherapy, or it is done in patients who want to postpone their conception. In these cases, many males come to us for fertility preservation, that because there is going to be delay in their marriage, and also people who are aware, they come to us. Process of ovarian cryopreservation. Ovarian cryopreservation is done in several forms. We can firstly we can stimulate the ovaries and we can take out the eggs, that how it is done in conventional IVFs, or we can do ovarian tissue cryopreservation, or in patients who don't have time, in that we put a laparoscope and then we immobilize the ovaries and put it in the POD. So that is the later form, if still you're going for a chemotherapy, say the next day, because the cancer is so advanced. Embryo cryopreservation. Embryo cryopreservation is done in patients with IVF cycles in whom there are more amount of embryos. Like if a patient has conceived once, then he can come for that same embryo transfer in him after maybe 2 or 3 years, so that the embryos are at the same stage. The patient has aged out, but his embryos are at the same stage. It is a big boon for humanity that we can preserve. Anything preserving is good for the humanity, and it can preserve your genes. So it's a good thing.